Welcome, everybody, to the Synapse Philosophy Podcast. I'm your host, Dr. Haig John. I have Dr. Barry Hobbs here and Dr. Stephen Shargell, and we are on D.D. Palmer's 1910 book, The Chiropractors Adjuster. And we were looking through, we're skipping around a little bit. He taught his classes from here. He taught human physiology, neurophysiology, biology. He taught it out of these books. So we're kind of skipping the osteology of things. So we're changing up a little bit. So we just skip a little bit of those things. So we just skipped a few pages. Now we're at page 636. And this one's the measles. And I know we're tired of hearing about the measles, but let's see what D.D. Palmer has to say about it, okay? This disease is also known as morbilli and rubioles. Maybe I shouldn't have said I was going to read this one. What's a morbilli and a rubio? I have literally never heard of that before in my life. It is not dangerous to life. There we go. But the sequelae of embrace morbid phenomena. I should have chosen to read this one. In the form of various chronic affections due to the medications or vertebral lesions. Due to medications and vertebral lesions. It's exactly the same we're talking about literally right now of causing the problem. Okay. The onset of the disease resembles a series of cold or an attack of influenza. The individual sneezes repeatedly. There's an acrid discharge from the nostrils, and the eyes are red and inflamed and watery. There is a soreness of the throat and a dry, hoarse, painful cough. There is usually a chilly sensation, but rarely a distinct, pronounced chill. There is fever, but it is commonly less intense than that of scarlet fever. The appetite is impaired, nausea and vomiting may occur. There are wandering pains in various parts of the body, especially in the head and the limbs, generally debilitating and languor. Convulsions and bleeding at the nose may occur, and the eruption of the skin, invisible evidence of moderate dermal and subdermal inflammation. The liver in acute cases may show focal necrosis resembling those found in other inflamed organs. The disease affects principally the young. The medical dictionaries and pathology books assert that one attack confers perpetual immunity. I love that. Exactly. The principal reason is that it is a disease of childhood, a period in our lives that never comes but once. The following complications often follow measles: pneumonia, bronchitis, phlebitis, otitis media, diphtheria, croup, and primary lesions as a poison which drew a dorsal vertebra out of alignment. So causing a subluxation is how we would describe that right now, because most of the subluxations come from within. You cause stress on the organs, the system goes into just like blowing a breaker switch in your house. It's the easiest way to think of it, far more complicated, but the easiest way to think. In a primary affection or in any of the secondary named, there will be found a displaced dorsal vertebra in the upper dorsal, and on its right side, an enlarged nerve, very sensitive to touch. Oh my gosh, I can't wait. Well, yes, I don't want to see children with measles, everybody healthy, but why don't we test out this hypothesis? If the adjuster will examine this rigid nerve previous to adjusting and again immediately after, he will find a vast difference in its texture. Before adjusting, it will be found contracted lengthwise, enlarged diametrically, and rigid and tender. Immediately after, it will be lax and not sensitive to the touch. The fever will rapidly subside. Okay. Thank you, D.D. Palmer. Now I'm going to finish the rest of this. There are two kinds of doctors: the dispensing and the prescribing doctor. A dispensing doctor is one who carries his medicine and gives it direct to the patient. A prescribing doctor is one who carries no medication with him, but writes the prescription, which is taken to the drugstore named on the prescription tablet, for which is usually gets the percentage. He was letting us in on the scam. He was letting us in. So what do you guys think about our poignant moment that no one has talked about in chiropractic that I have heard yet of Dee Dee's talk about measles? I know it's ridiculous, right? Why are we even mentioning or spending our day on it? Go ahead, Barry.
No, I think it almost sounds like D.D. Palmer actually went to medical school. He's very detailed in the pathway of measles, also what to find. And despite what they say about D.D. Palmer, it's humbling to see how detailed he is at this disease, a condition, and then also to trace the nerve tracing, and to find out what you're going to examine as the adjuster.
I can't wait to share this hypothesis, right? Let's see this. If he's experimenting, it's right here. Let's see if that nerve root. I say anybody's, thinks their child has it, bring it into me. Let's see if we can make some changes by adjusting the vertebral subluxation, clearing that vertebra. I'm absolutely game. So I want to thank literally that there's a lot of people that listen to this podcast now. We're 19,000, almost 20,000 people around the world. And, we're talking about real life things. This is written in 1910, but the reality of it is this is literally poignant for right now. Everything we have read is poignant for right now and expectations of the future. Let's put it in that sense. How do we guide health? How do we guide vitality? How do we give people confidence? How do we give them hope? Think about that. As hope is what we're really talking about. If there's no hope for me that we're just going to get sicker and sicker, more of the chemtrails dumping on me, I just don't want to believe it. Even though I'm getting the shots and eating the food and whatever it might be, I don't want to think. But ultimately, DD, even at the end of this, DD said, look, it's all a cycle. Somebody's getting, they're making money at every end of it. And I'm sorry, at this point, it's like we've got to really stand up for our life. Who's speaking for the babies? That's was literally is who's speaking and standing up for the babies. That's why I'm doing what I'm doing every day, even doing this. So that's D.D. Palmer, 1910, page 236, about the measles. Where do you guys want to jump to next? The sympathetic nervous system? That's the next chapter. So we're getting back to what is the mission of Save the Babies. And, seeing all the children that we have over the years, Steve Shargell down there has been in practice for a couple of years. What is it, almost 40 years, Steve? And, Barry Hobbs, we all share the gray hair of service through the years. You've seen our babies, a lot of the injuries we see and issues we see with adults started from a difficult birth. Upper cervical malfunction, I feel, comes from birth trauma and things that could be avoidable. Fewer C-sections, emergency cesarean section. What happens? The baby actually gets stuck. They push it back through. Could you imagine what's happening in that little cervical spine right here? And then he was just so happy. Oh my God, I'm ready to come out of the world. Holy moly, what's that world out there? Right? I'm not honoring the birth. If the pelvis, hips, and pelvis and sacrum move properly, births go so much better. It's not makes it easy, let's be real, but it's able to do what it's meant to do, which is open and close. Those joints are meant to move. They pump the CSF around our brain. Same with breathing in and out of the nose. When the atlas is subluxated, sacrum subluxated, you got a high chance of problems at birth, period. Could you imagine? And I've adjusted a lot of ladies. I've adjusted a lot of children in the hospitals and at home births. And the sooner the better. Even home births, right? Hours long labor pushing in the pelvis, right? Hours. My wife pushed for 12 hours. Pushed. I mean, my daughter has occipital, it just started changing. Occipital subluxation, atlas and occiput used to lock together. So I know what it's like to work through birth trauma. It could have been a lot worse. We have babies that went to PT, and I'm PT they do wonderful work. I'm not picking on that, but no chiropractors corrected the subluxations, so they still had a head tilt, right? And then now I'm seeing the bones have actually changed. It's called Wolff's Law. You change the stress on the bone changes shape. Structure determines function. The function determines the structure. So we see those aberrant changes of function in these children's necks. They grow to be adults. I see people, elderly people, oh, I was a forceps birth. Their upper cervical is a mess. Where else? They've had heart problems their whole life, blood pressure, everything. So mid-thoracic, what's happening? You're pulling. That's the parts trying to anchor and say, oh, I got some big muscles. The only muscles in a newborn. I mean, in reality, they're meant to move a little bit, but those lats are anchored on so many of the ribs, right? And they're pulling, and the whole system's pulling up the whole thoracic spine with the shoulders. So that's where we see all this cervical injury. That's what I'd like to see is a chiropractor able to see those children. No matter what, it ain't easy coming out in this world. It's not the doctor's fault. It's not who I'm blaming. It takes a lot of work to get out here. If children were adjusted very early, check for a subluxation. If the atlas was subluxated, atlas, axis, and occiput. Let's just make sure they're clear. And I say sacrum too. You got to check the sacrum. And a newborn is so easy. And so could you imagine SIDS? They say SIDS is actually from cervical dysfunction. We're writing the paper about it right now. I literally got the research and we're putting it in a book. It's the other epidemic. Child laying on their side, which is where they really want to be, but their atlas has been jammed up into their skull, right? Excuse me, I didn't mean to be graphic, but in reality, higher probability of SIDS. SIDS is I literally cervical subluxation gone awry. Babies on their back now, the head to the side, that you end up with the flat spots. So it's a difficult thing to navigate. Chiropractors need to be there. That's where I see our vision really is taking care of these babies. That's my the reasoning for Save the Babies and making the documentary. Dr. Barry Hobbs, I see you just unmuted.
Yeah, to just jump on what you're saying here, it's become in modern medicine one of the most stressful events that's occurred. It's supposed to be a natural event with birthing, with gravity pulling it. However, the way that it's been set up over the years and generations has not been natural. And just to review the anatomy too, the atlas is actually formed. It's bony material, so is the axis. And then, of course, the occiput, the skull of the infant is in the back. However, C3, 4, 5, 6, 7 is cartilaginous. They're not formed until in females 4 or 5 years old, and then a male wow. 6, 7. So one of the first things that occurs, right, whether it's natural, vaginal, or whether it's a C-section, is they want to pull that head out. And whether it's a vacuum or their hands, they're grabbing the head and they're twisting and turning and yanking to get the baby out in the least amount of discomfort to the mother. And then guess what? And I use this in education all the time. What's larger than the head? The next thing to come out, the shoulders. So, of course, once they get a good grip on that head, they're wrenching and twisting and twerking and subluxating that child, that infant. And it's important to make sure that the most movable segment in that spine is the atlas, and it is bone to protect that brainstem, which controls all our involuntary reptilian functions, such as bowel, bladder, breathing, heart rate. And that's where the SIDS comes in as well, because if that area is twerked and twisted, you're going to have difficulties breathing in the function of life there. So just to write off what you were saying, it's a very unfortunate, traumatic experience for mom and the child. And everyone deserves to be back in alignment and back clear with that intelligence that's flowing from the brain down the spinal cord to the body.
And that's so important. Thank you for all of that, because we need to know our anatomy. I've told hundreds and thousands of moms and dads and grandparents, be the most informed person in the room. What is your birth plan? What do you plan to do? How have you, what do you want? If something goes less than perfectly, let's plan for it a little bit, right? we'd like the least amount of Pitocin. If the time comes where we're not getting progression, this is what we suggested, as not suggested, had as our orders at my, when we had to transfer. We were doing a home birth. My wife pushed for 12 hours. We had to transfer to the hospital because that's too long. Baby's heart rate fluctuated a couple of times. So we go to the hospital emergency room. Doctor pushes me aside and she's busy. It's 5 o'clock in the morning. I'm not blaming her. That's not my thing. She's doing her job. And most men have been trained to be idiots about women, children, babies, birthing, periods, all that stuff. We're not stupid. And so what we have to do is empower men to be men and to take care of their tribe and to be there for their woman and their child. And that's an important thing. So that's where I got pushed aside. I did get a little grouchy at that point, but it was also 5 a.m. for me. And my wife had been pushing all night like an Olympic athlete. And I said, because she wanted to throw up all the Pitocin, give me this big giant dose. And you know what happens? The uterus goes into spasm, and then let's get the zipper out, and then it's a C-section. She was sunny side up, don't get me wrong. She's also stuck on her pubic bone like this. So what's she doing to her neck? She's like that, right? With no muscle strength whatsoever. This is the first time the cervical spine has gone from this going down, right, as a notochord, and then all of a sudden it's like this, an extension. So upper cervical, lower occiput, okay, that's where we see spinobasilar junction. We do a lot of cranial work. I do a lot of cranial work. It's very, very important for children and adults. But I said, we'll take the least amount of Pitocin, the tiniest drop. No, first I said, let's wait and see if she progresses. Is the baby safe? Is mommy safe? Yes. Heart rate is perfect with both. Let's wait and see if she progresses here in the hospital. She didn't. That's the prudent thing to do. Didn't progress. And then the doctor came in and asked me, what do you want to do? And she probably wanted to knock me in the mouth and knock my teeth out. I'm sure she did. I said, we'll take the smallest, teeniest amount of Pitocin possible. And that's all it took. It was just that one push. Okay. And it happened. So, not everybody's got the golden birth story, but I know we got this birth story to teach others about it, but also to empower dads, moms, everybody. Go ahead, Doc.
Yeah, one of the greatest joys of being in a clinic and serving the people over time is that whenever you have these practice members who had children that when they were not adjusted, and then had children while they were maintaining their adjustments, whether it's every other week or once a month, it literally is night and day difference, because it should be a natural, glorious procedure in life. And there's tons of individuals who were adjusted and then just had wonderful, natural, non-stressful, non-laborious, natural births that occurred. And the children that come out are naturally and innately healthier than the ones who, when the mother was not, when the mother was subluxated and not well adjusted in alignment.
When the mother's nerve system, this is, literally the tree of life inside of us. All of that life coming through the spinal cord, through the nerves, doing what it needs to do. And then you put her on her back, and the inferior vena cava, the descending aorta, which are huge arteries and veins that bring all the blood to the pelvis. It needs a lot of blood for a reason. You have babies are heavy now, like say a 6 to 8 pound baby laying on that. What happens? That whole system. I know we're a bunch of men. We should be talking about it. It's what we're supposed to talk about. It's real life. It's our children. And what do you think? You can't get blood to that area. The whole system's going to stall. Getting it adjusted. I adjusted my wife's pelvis. Her water broke, but remember my baby's breech, which is basically, and she was upside down and head first, right? So adjusted her, and her water broke even more once I adjusted her sacrum. I'm a sacrum guy. I'm a low back guy, a pelvic guy. In SOT, I do a lot of adjusting there too, and it broke even more. She did progress again, but then she was stuck. So yeah, I mean, I could imagine what the difference in. I would love to see decrease in, of course, SIDS in the community, birth traumas like cerebral palsy, right? Could you see an easier birth? We see better outcomes, period, period. And somebody to care for, there's an adverse outcome that can jump in immediately and first take stress off the nerve system. After that, everybody has to do their job. Amazing things is maybe save a baby's life, but we clear the nerve system first, or else you have to work harder. I mean, would you guys agree? I mean, you guys have a little chiropractic experience, right? What would you say?
Yeah, Head, this is when you're following natural law, right? There's a power that controls and coordinates the body. That intelligence that was there when those two cells became 400 billion cells, and 9 months later, Innate's the manufacturer, Innate's the producer. So Innate knows darn well what she's doing, what's happening, just like anything that you've built or created in your life. You know every nook and cranny of that product. And so she knows. So this is following natural law. So if that information's disconnected and you're able to reconnect it, natural laws, natural results are going to happen. If you violate law, right, you're going to get results. They may not be the results you want, but you're going to get, quote, adverse results, such as symptoms and ill health.
That's it. So that's why we do this. That's why, I mean, if I could go to the office and, I mean, I show thousands of videos. We're teaching now, we have an online class and to get certified in newborn adjusting, because we need more chiropractors that are confident to go do that. And that is, and it's happening. And that's very exciting in our entire profession, but it has to be really focused. I really feel is newborns first and the pregnant mother by far. Go ahead.
You're giving me flashes of the handful of colicky babies that have came in, just screaming at the top of their lungs, irritating the whole office, being loud. And literally, I want to sit there and be like, okay, if I could just get to their atlas and adjust them and open this. However, clinically, right, you got to go through the new patient procedure. You got to talk to the parents. Usually the grandparents are bringing them in. And there have been numerous times where you literally get that baby, that child on that table, take that pressure off that brainstem, and instantly, like a switch, the crying, the colicky, the screaming, the screech literally goes away. And then you hear and you see them just take that good deep breath in, and then literally just back to normal. It's just amazing. You just made me think of that thing.
We had a baby the other day. I see a lot of babies, and I'm making a contact in the atlas, and all I do is basically change the vector, right? I'm finding the contact. Am I in the right vector with that atlas? And I'm not impulsing. I'm pressing about as hard as you'd put a contact lens in your own eyeball, right? Or me, I'm a big chicken, so that's why I wear glasses. But I saw her belly. She wasn't feeling good. She gets gassy, and her belly was just full, right? It was just tight. I adjusted her, just changed my vector, and I could see her body just, her tummy just actually shrink. I know it sounds so amazing. And then I tell you that baby had a blowout, but she had been constipated, right? She was a few weeks old, just learning. Body barely even knows how to, function. It did everything through the umbilical cord, but then it had a stressful birth. What do you do? And every birth, I mean, tell you, none of them are easy. Every baby needs to be checked for a subluxation, period. Period. Well, that's why we're doing this. April 26th, Life University. It's called Save the Babies. We're filming for our documentary. It's Save the Babies. This is a family's first revolution. And that we have to help the helpless, is what I always say. They can't help themselves. The other part is our elderly. We have the baby boomers getting older and taking care of our elders, and I'm getting through there myself. And since we had Medicare, they get the worst natural health care. They get the worst chiropractic. There are a lot of great chiropractors out there that take Medicare. I'm not saying that, but in reality, nobody can have an all Medicare practice. You can't take care. You got to have everybody in there. I'd like to just go into the old old people's places and go take care of them all day long. You know, you'll learn a lot. We'd all learn a lot. Let me tell you, they won't let you go. I want to tell you something. You look just like my son. I'm joking. I am your son, Mom. No, I'm joking. Listen, you guys, I had a great night. I had a few rants. We had a few rants. Steven, I love you, brother. Barry, I love you too, brother. And you guys can make it to Life University. Everybody you can. I hope you do. God bless you. See you on the 26th. See you soon.